Here's a video on things that I think every woman should know. Your vulva is the outer part of your, well, I don't want TikTok to ban me, so yeah, lady parts. And what you don't want to do is wash this area with harsh soaps or anything scented. I'm seeing a lot of people promote scented products online. No. What you want to do is be washing your vulva with warm water or a very, very mild soap, because in using fragrance soap or harsh soaps, you will ruin your pH balance, and you do not want to do that. On the topic of lady parts, bacterial vaginosis is not an STI. Although it can be triggered by sex, it's actually caused when there's like an imbalance of bacteria in your vag. If you feel like you have BV, look up the symptoms online and go to see your GP. GPs in the UK typically prescribe an antibiotic, but another thing that has worked well for women is a probiotic suppository, probiotic supplement, or boric acid. Check your breasts. If you don't know how to do it, Google it, but try to check at least once a month. Check for pain, check for discharge, discoloration, rippling, anything that is out of the ordinary. And I say this as someone who has checked and found lumps on 2 different occasions. Luckily, they were benign, but yes, check your breasts. 1 in 5 women have a retroverted uterus, and that's when their uterus is tipped backwards towards their spine. It doesn't cause any really serious health conditions, but it can cause quite painful periods and discomfort during sex. If you think you have a retroverted uterus, your doctor doesn't typically tell you, but you can ask during a cervical smear. If you're sexually active, using lubricant is not embarrassing. It's not something you should be ashamed of. Sometimes you might need it because you're going for a long time, several times. Sometimes you may require it because your partner is significantly larger than average. And yeah, sometimes you might need it because you're not as aroused as you would like. In that case, obviously talk to your partner. But yeah, using lubricant is not something as a woman that you should be ashamed about. Explore alternative ways to manage your period pain outside of painkillers. Consider using things like evening primrose oil or raspberry leaf tea, or a TENS machine massager that you can place on that area, hot water bottles, because heat can really help to relax your muscles. I'm saying painkillers definitely have a time and a place, but you don't want that to be your only source of pain relief. I hope you enjoy this video, and let me know if you would like a part 2.